what if we could make our healthcare system in America a lot smarter? And the way you make it smarter is that you bring in much more knowledge to bear upon how and when healthcare is delivered. And we recognize that one of the biggest places where there was gaps in knowledge is what is happening in the home. And this problem is particularly critical for the elderly who have multiple chronic conditions, and every day is a struggle to stay on top of one's self-management of one's own care, and that if the caregivers, including the physicians or the health coaches or the nurses who are best able to support an elderly into best self-management, knew what was happening in the home, then we could do a whole lot better with our delivery of healthcare than we do today. So with that realization, we founded Senscio Systems. So our commitment when we built this company is we were going to create a healthcare environment where we're able to sense, meaning collect data about everything that can inform us about our own health, and Senscio, meaning to interpret and understand the meaning of all of that data. So hence Senscio. We think that there's a way to automate the interpretation of some of that data from within the home. So what we are building is the integration of the devices that actually will measure your vital signs, or will collect information about what it is that you're doing for yourself, which by definition also tells us what it is that you're not doing for yourself. That's all data, but the artificial intelligence actually stitches it all together and say, okay, now what does this say about the current state of your health? Is your health getting better? Is your health getting worse? Is your health getting better because you're doing all the right things for yourself? Is your health getting worse because you're missing some critical self-management things that only you can do for yourself? So stitching together all of that data and creating an understanding as to what is the state of a person's health and why did that state occur? How do we tie it to things that the patient actually did or did not do? That interpretation of everything that can be observed and measured into a narrative that can then be acted upon for optimal healthcare delivery, that's where artificial intelligence comes in. So Ibis is actually our system for collecting data in the home, for making sense of the data that is collected from within the home, and for then orchestrating the workflow, starting perhaps with the coach, who is the first line of intervention, then perhaps the nurse who does some clinical intervention, and then ultimately the doctor when that's where the clinical intervention needs to happen. We thought, Ibis, it's the intelligent behavioral intervention system, because that's what we're trying to do. We're intelligently trying to adjust the self-management behavior in the home so that self-management is as good as it can be, because really self-management is the first driver of what our health ends up being. Ibis is also a bird, a very elegant bird, a beautiful bird that balances itself so beautifully just on one leg. And what we are trying to create is a system that allows the people we support to balance their lives. Life is hard when you have multiple comorbidities. You're losing your cognitive ability. You're losing control of your life. Our goal with Ibis is to restore as much of that control as we can to the person who is losing control, and we're going to help them regain that control. So for us, Ibis is metaphorically is that bird that can balance itself on one leg, graceful, ready for flight as needed, and that is the image of the type of balance and empowering and additional strengthened ability that we're bringing to people who would otherwise be losing it.